Hello and welcome once again. Today's discussion will be about viruses. Viruses are microscopic particles that exist everywhere on Earth. They are present in animals, plants, and other living organisms, and they can sometimes cause diseases. They are biological entities that can only strive and multiply in a host, which is a living organism, such as human, animals, or plant. They consist of genetic material, RNA or DNA, with a coat of proteins around it. They also do not contain ribosomes, so they can't make proteins. This makes them unable to reproduce independently and totally dependent on their host. The envelope of crown-like spikes. So for today's discussion, I have invited today Dr. Rana Jawad Asghar is a Chief Executive Officer of GSI, that is Global Human Strategist and Implementers, a consulting company in Pakistan. He is adjunct professor of epidemiology at the University of Nebraska, USA, and member of WHO roster of experts in epidemiology and surveillance. So let's get Dr. Asghar on board. Assalamu alaikum, Dr. Jawad. We are live now.
Okay. Walaikum assalam.
Yes. How are you doing today, sir?
I'm doing all right. Thank you for inviting me in your these talks.
All right. And Dr. Meher also has joined us for the discussion. So we are live in my book, in my group that is Empowered Women. And I will begin with Dr. Jawad. What are kind of different viruses if you see in Asia and especially in Pakistan that people suffer with?
Sorry, I missed your question's last part. Could you repeat that question? The last.
I was asking for, like, especially what type of viruses do you see in Pakistan that people suffer with?
So thank you very much for inviting me. The viruses is a huge subject, and we don't even know how many viruses exist in the nature even today. We have just, we are learning about them on a daily basis, and we have just, let's say, identified those viruses which are affecting us as a human at that time, at now. But we have still no clues, we don't have information about a lot of other viruses which are in non-human settings. They may be infecting plants, they may be infecting animals, different types of animals. So the whole variety is there, the big jungle is there. We have just scratched the tip of that, let's say, mountain or iceberg. In Pakistan, historically, we have, the most famous viral disease, which is now made Pakistan infamous, is actually the polio virus. Everyone knows about it. And this is the second viral disease which the world is trying to eliminate or eradicate from this world. The first one was the smallpox, which was eradicated in 1970s. But this one, smallpox, pretty much everyone else eradicated it for years and years. But Pakistan and Afghanistan were only two large countries which were having those wild virus cases. And now, unfortunately, again from Pakistan and Afghanistan, it is spreading to the rest of the world. So this is a battle we thought we have already won, but we may be losing it again. Then there are other viruses. In Eid al-Adha, we face Crimean Congo hemorrhagic fever, CCHF, which is a deadly disease. But we also need to remember that dengue is a viral disease also. So then, you keep going on. The hepatitis, all 5 varieties of hepatitis are viral disease, and hepatitis C is one of the, what I call a silent killer, which has affected our populations hugely. Before that, it was hepatitis B, but after vaccination initiated, its cases have gone down. But hepatitis C is the main cause of liver failure in our part of the world. So there are many viruses. I've
Right.
just picked few which
Sure.
are most common to Pakistani population.
Okay, so which viruses do you see that they are deadly viruses and we're still like, struggling with to just get rid of these viruses? Then you think that those viruses are really deadly and we should just take some action in regard.
So as I said, the polio virus is one of the a test case for Pakistan, because rest of the world has eradicated it. So we are unable to do it. So that's something embarrassing as a public health professional for
Mm-hmm.
Pakistanis. Number two, at this moment, we have this hepatitis C, which is a virus and which is affecting and it's a deadly disease in many, around 10% of the people, because they go into the liver cirrhosis and they die because of liver failure without even knowing they are diseased until it's quite late. So in the Pakistani context, I think hepatitis C is a major, disease. Certainly, dengue affects at a seasonal level, and small other diseases come and go. But I think on a long-term basis or on a daily basis, hepatitis C is a major cause of our mortality and morbidity.
Okay, I've also heard about monkeypox, and that's another virus, and we can talk about it also. If you can just share some light about its spread, and in the whole world, where is just spreading more and giving more problems. So my viewers would also just like to listen about it.
So first, when we are saying about viruses, I didn't mention COVID-19,
Yeah.
and the virus which spread it is called SARS-CoV-2. The name of the virus is, and the COVID is the disease which it causes. That's a major problem across the globe. So I didn't mention it because it's not just specific to Pakistan; it's all over the world. The
Mhm.
monkeypox you mentioned, it's an old disease also. We identified in 1970 the first human case. But from that time until very recent, it was confined to few African countries. And
Mhm.
and every year there will be cases, but limited to that geographic area. There were some instances of international spread of monkeypox, but that was also always linked with travel from the African countries or goods transporting from those countries. But now, like 2 months ago, these monkeypox cases started to be identified or diagnosed in European countries, and with no traveling to Africa. And that is the current, what we call the major epidemic of monkeypox in mostly Western countries, but has already spread to 70 plus countries. So it has not limited itself geographically to Africa or to the travel links to Africa. Until now, and I says until now, it's a milder disease with 1% or less mortality, and a person normally recovers after a few weeks. But if you are immunocompromised, if you have a chronic disease, if you have other immune system problems, then this disease could be serious or deadly in you. So it depends on who get the virus. So that's a new virus
Yeah.
for the most of the world, even though the virus and disease were old, but most of the world was not dealing with it. Similarly, like dengue, like
Mhm.
20 years ago or 30 years ago, dengue was limited to few countries in this world. And only when this climate change started, the mosquitoes were able to invade the other parts of the world where
Mhm.
they traditionally that type of mosquitoes were not present before. We saw the spread of dengue to nearly 200 countries. So, and I think that's what happening with monkeypox.
All right. Assalamu alaikum, Dr. Meher. Dr. Meher, if you would also like to add some, in that regard for monkeypox, so we'd also like to listen from your side as well.
Actually, thank you, Walaikum Assalam, and thank you so much. It's such a great pleasure to see Dr. Rana Jawad Asghar and enlightening us. So my addition would be just a drop in, because I work with communities and I'm a family medical specialist, and I've worked with communities. So my basic concern would be a disease surveillance, what treatments are offered, and how in Pakistan we are combating this. I've seen your writings, Dr. Saab, very important writings about involving epidemiologists in disease surveillance and giving them the upper hand in decision making and policy making in Pakistan. As you rightly pointed about hepatitis C, I have been seeing it every second to third female. I am living right now in Islamabad, Barakau area, Badingala area, and I've seen that every third, fourth ladies who are in their 40s are suffering from hepatitis C, which is a major problem. So my question would be is what are we really doing about disease surveillance and combating hepatitis C and prevention of long COVID in Pakistan? Because I don't think we are really aware of the effects of long COVID, and are we collecting any data about it or what's happening? So
Yes.
I would like to ask you this question.
Yes, but before Dr. Rana Jawad, if you would like to respond, I wanted to share something here as well. As a matter of fact, that here in South Africa, I live in South Africa, and our government, what they did, that they just completely told us not to use mask anymore. So there is no need to use mask. And what I'm just noticing here in South Africa, they are taking fully control of fighting with this COVID-19. So I wanted to also know about Pakistan, Pakistani context, that what's happening there, as Dr. Meher also, mentioned, and in other parts of the world, other parts of the countries, if you can shed some light in that regard of COVID-19. Whereas I and my husband also, we just fully vaccinated with the dose 1 and dose 2, and still that I was also hearing in my family members that after vaccination they also got ill, got sick with this COVID-19. So what would be your thoughts about it? Please share it with my viewers.
Yeah, important questions. So first, I will answer to Dr. Meher, and short answers to her both question is absolutely nothing. We are not doing anything on hepatitis surveillance, or we are not doing anything to prevent long COVID. The only hepatitis C surveillance system functioned under my program, which was US CDC's field epidemiology lab training program. And we kept it, that was the only actually program in the region where we were doing a surveillance of acute liver diseases due to different A, B, C, D, E, all 5 viruses. And in the region, the whole of the region, even in Egypt, which had most of the work of hepatitis, they didn't have a similar system. But that ended, I think, after I left around 2018 or 19. So at this current moment, I'm not aware of any surveillance, proper surveillance of hepatitis, any form of hepatitis. So that's the question 1. Question 2, which also now linked to what Kiran has asked the question in the South Africa, that the different governments are abandoning the public health measures, and once you abandon these public health measures, people are gonna get infected with COVID, which is happening across the world, which is 6th wave or 5th wave in different countries. And eventually, this was a new phenomenon, the long COVID. But now I think there is building consensus among experts that around between 1 to 10% people, irrespective of their severity of disease, will get a long COVID. And the long COVID is that after even 6 months, they may be still experiencing the symptoms of COVID. People have done studies like for the 30 days after the recovery of the COVID, and the mortality due to cardiovascular diseases is high, and the strokes is high right in the first 30 days after the COVID. So we should not take, number one, COVID as a disease like flu, even though you may have the symptoms like flu, mild symptoms like flu, but that doesn't mean that it is like flu. It's a new disease, just like we are learning about long COVID now. We don't know about the long-term consequences of it. And I will share you my own personal experience of COVID, and that answers Kiran's question also. I had two original vaccination doses, then two booster doses, and my kids were vaccinated too. And we took as much as precautions as you could in a society where no one else is taking precautions. Eventually, one of our kids got infected, brought the infection home. As soon as we realized about it, we tried to implement isolation and ventilation, but Omicron BA.5 is so infectious that one by one we all got infected. It was a mild disease. We all recovered in a week time, individually respective. But I noticed that in my fingernails, there was splinter hemorrhages.
Oh.
So that shows even a mild disease can cause such a damage to your blood vessels and your blood. And that should be a worrisome thing about most people who say, oh, this is a mild disease. Number one, it is not a mild disease. I lost two of my best friends, both doctors, in this COVID-19 pandemic. And they were properly healthy. They were not sick. They were not long-term sick. They were very active. But that was one thing. You get a serious disease and you survive or not. That's one question. But two is, even if you survive, even it was a mild disease, what chances you have of the long COVID, and what damages it has done to your body, different organ systems of your body. We are still learning about it. So it's still sensible to protect yourself. In Pakistan also, there are no precautions. I just recently traveled last week. I was actually in Singapore attending a World Health Organization meeting, basically on these pandemics and how we can be well prepared for that. And I experienced the journey starting from Islamabad. At airport, no one was wearing masks, not passengers, not even staff of airport staff. But once we reached Bangkok, there everyone was wearing masks, 100% compliance. When we went to Singapore, 100% compliance, everyone was wearing masks and everywhere. I think those countries which have previously faced a original SARS outbreak,
Yeah.
they are well used to, and they understand the value of protection, and they will in a long term will be at a better position than most of us. Sorry, the answer, because there were three questions, the answer became longer.
Not a problem. Dr. Meher, you raised your hand. You wanted to ask something, so then I shall begin as well after you.
Yeah. Dr. Rana Jawad Asghar Sahib, it's very important. In my experience, I've seen that, how we struggled against tuberculosis. And finally, we formed a kind of, national network, and people were more aware, and we formed centers, and there was a program in which people entered. It was a major way forward in combating this deadly and sociological disastrous disease. What I would suggest is that even in tuberculosis, like they have formed the Dupasi Foundation, which is, I think, working very hard in combating this disease and spreading awareness and all that. So I would suggest, you being in such a powerful position, would go ahead for hepatitis C also, some kind of linkages be formed, and some associations or some NGOs should come together and fight against this disease. This is very important. The other thing that you mentioned about splinter hemorrhages, I've seen very young men, healthy men in their late 20s or early 30s suddenly die of heart attack. So there is a very strange phenomena going on. Maybe they did have a mild COVID infection. You don't know. The other question I wanted to ask: are you aware of any studies being done in Pakistan on pregnant women, with the COVID infections? Or the other thing I wanted to ask about, to mention to Kiran, is the, like people who have realized that COVID can be deadly. They are using mask, and I think mask and all the precautions of social distancing and unnecessary travel or unnecessary going into crowded places should be continuously followed, and the community continuously be made aware of the dangers of this infection, especially children, because children are the ones who are bringing it into homes. I've seen several cases. So, and pregnant women, immunocompromised people suffer most, and elderly, obviously. I've also seen several elderly patients and patients on kidney dialysis, etc., lose their lives, and it's a sad loss. So this is my input.
Before Dr. Rana just would like to respond, I just wanted to mention one thing here, maybe because different government, different countries, what do they do? Like, from their side, when they just see that, and I've also heard that before with another epidemiologist, that almost if 90% of people of any country would be vaccinated, so then there is a cure, and then of course then we can prevent ourselves, to spread more with this disease, with this virus. So that is why maybe they just took this kind of decision that no more mask, and because they are not seeing more cases in that regard, and that is why they just took the decision. Even though my children, they go to school and they are not wearing mask, and even though they were just scared on the first day of the school that mama, we are going without wearing mask, so I do not know, it's a bit weird. And we were going in the market. I just made up a small vlog as well that I'm going into the shopping market without wearing mask. I'm like, that's quite weird, but yeah, now this is kind of different would be scenario happening here in South Africa. So that is it. And now I would like Dr. Rana to respond in the regard for tuberculosis, and then I have another question for hepatitis C.
So, so Dr. Meher, I'm not a powerful man at all. My power is in my pen. So I'm an advocate, and I keep advocating for public health measures. And I think your suggestion about NGOs coming together to, to educate people about this disease and to do something about it is a good idea, and people should follow on that. On the question that to Kiran, finding no cases or reporting fewer cases does not mean that you have fewer cases in that country or in that region. These are two different things. Surveillance of this COVID-19 is in a poor state in most countries, including USA, because there are a couple of things. Now people don't go for PCR testing, and people have at home a rapid test available to them, and they test them if they want. And these tests are never reported to national numbers, number one. Number two, many people now don't even opt for test, and they assume that they have COVID and okay, we will be fine in a week time or so. So at this moment, the numbers you are getting at national levels are hugely underreported cases numbers. And I just tweeted a couple of days ago that my estimation is that you can easily multiply it with 20. So if you are 1,000 cases reported, think about it as a 20,000 cases. So, and we are not making these numbers up. If you look at the countries with a better surveillance of COVID-19, you will going to see straight vertical line of cases going up. Look at Japan, because they have a pretty good surveillance system. Cases are going like this up. You look at the Singapore, it was cases going up. UAE, United Arab Emirates, because they required 30 days PCR testing if you are going to public places like schools or colleges. So pretty much they are doing a lot of PCR testing. There again, you had a spike of cases. So in the countries who are trying to do it right, we can see those immense increase in the jump of cases. And in Japan case, it's many times more than alpha, beta, or delta waves. So this one is Omicron, BA5 is more infectious. But don't be patient with the, if Pakistan or South Africa are not reporting a bigger number of cases. But here I also would say that SOPs need to be evolved with passing of the time. There is no need of wearing mask if you are in outdoor settings. And if you are gone to a garden or somewhere, you don't need to wear a mask. But if you are inside a badly ventilated space, like office or something, then you should be wearing not just surgical mask, I would say KN95 at least, and time your space there. If you work in offices and you have to spend 8 hours in a, in that office, encourage the administration to have, open windows policy. Open the door. If there are no windows, open your door. Use fans to circulate the air. The problem is this is an airborne virus. So if someone comes and air is not moving, the whole quantum of that virus will stay at one place. You come after that person and you will inhale that virus. But if it is a ventilated place, the virus numbers will be diluted. So even if you inhale a little bit of them, your immune system will be able to protect you from a serious disease. So ventilation is key. And so we need to, add that into our SOPs and, try to have less restrictive SOPs so people can live their life, people can enjoy their life, they can run their businesses, but still mostly protected. And ventilation is the biggest asset we have, and we are not utilizing it at official level even today. But we have to, if we want to have an unrestricted life, we should add ventilation as a major intervention in our way of life.
All right. Thank you so much, sir. I've got only 8 minutes to go. For my viewers, if they have any question, they can just type in the comment section below. And last question I would ask you, sir, about hepatitis C. Is it contagious? And what is the spread like? How's the spread in Pakistan? And what is the cure for this? And if you talk about the treatment, transmission, and all about hepatitis C, if you just can shed some light on it, that will be the last question. If Dr. Meher, in concluding remarks, you want to ask something, you want to add something, then you can go ahead after that.
So the hepatitis C and B, many people think they are spread because of the dirty water. No, they are not spread because of the dirty water. They are spread through your blood fluid. For example, if you went to a barber shop and you get a cut there and the blade was not clean, if you get to a dental surgeon and his equipment was not clean, if you went to a doctor and a procedure was done on you in operation, small or big, and those things were not cleaned properly, you can get infected. Or you have a sex with somebody who was the hepatitis C patient, and then you get hepatitis C. So that's basically, if there is a good infection control practices. So if you go to a dentist, make sure these are sterilized equipment he has. If you go to barber, make sure either take your own scissors and things like that with you. That's another way of protection. So this is the way. And the blood, if the blood is given to somebody, make sure that it is properly screened for all those diseases, including hepatitis C. Now, pretty much everywhere in the world, blood donation is screened for those common viruses. So, but make sure it is done. So that's the way it is spread. But the many times, even a person is infected, he will feel fine, fit, until uh, his um, his symptoms become stronger and stronger and stronger. At that time, the liver is already damaged. So if you think you have an exposure to hepatitis C by unsafe injection practices, uh, or hospital procedure where you are not sure about there's sterilization, get yourself tested for hepatitis C, even if you don't have any symptoms. So I will stop here.
Right. Okay, Dr. Behar, in last, if you'd like to add something, then we would allow Dr. Rana to go, because now we just got only 3 to 4 minutes left behind. So any concluding remarks, and then we would thank Sir Rana also as well.
Okay, Dr. Rana, thank you so much. You gave us such important information, and I'm sure people will listen to it and forward this video so that more and more awareness is spread. My question to you again is about women and children. What are we doing to make them more aware of the effects of polio, and for receiving vaccination in all the preventable diseases? And that's my question to you. Thank you, sir.
So, yes. So sorry, I missed your earlier question about any study about pregnant women having COVID. I'm not aware of, but I'm sure someone may be doing it, but at least I'm not aware. The government EPI program, which is vaccination program, routinely do public health education sessions, media campaigns to encourage mothers to get vaccinated, to get their kids vaccinated for important vaccines. And I think slowly the government may have, or should be doing it as a requirement if a kid has to go to school. Some schools already are doing this. They want to see the vaccination card of the kid. So once it's more common practice, and this is considered as an important part, so then maybe most people will get vaccinated. But this is a difficult job, but government is trying to do.
Dr. Rana, here I would just say thanks a lot for coming today. I would definitely gonna soon again arrange another session with you, because I wanted to know about children vaccination as well in regard for COVID-19 as well. Thanks a lot for coming, and I hope that this session would be very much insightful for my viewers, and have a lovely day from my side.
Thank you for inviting.
Okay. Bye-bye. It's a pleasure.